There we go.
Okay, I just want to say welcome, everybody. Thank you for your time to come tonight to our Holistic Cancer Prevention and Treatment webinar. And this is going to be recorded. And the reason why is there's so many that wanted to join, but that just could not be here live. So we record these kind of things because we just want to get the message out to more people. And plus, it's nice for you to have the recording because you might want to listen to some of the things again. So I met Candace virtually. I think it's probably been about a year and a bit now, Candace, just online, and she was doing a holistic cancer talk like she is now. And I remember taking crazy amounts of notes and going, oh my gosh, this is like the best information. Why is this not available to us? Like, how come is that we're not told these things? And it just immediately made me feel if I ever get diagnosed with cancer, have a close loved one that does, I have some natural treatments that I can be thinking about, and I don't have to be all stressed like, oh my gosh, fear sets in and I have to do this and I have to do that. Easy to say when it's not me being diagnosed, but I felt so comforted knowing that there was all these other holistic things that I had not been aware of. So just that I could tuck in my back pocket if I ever needed it. So a little bit, I just want to read a little bit more like a bio on Candace, but without getting into too many crazy amounts of details. Candace has walked closely with countless of individuals through some of life's most sacred and challenging moments, always with compassion, clarity, and a fierce belief in the power of divine restoration, both in transformational work as well as clinical experience. For the past 4 years, her alternative and holistic cancer treatment private practice has helped bridge the gap between alternative healing and modern medicine. Transformation is not just a skill she teaches, it's a skill that she lives. And I think that's a really, really important point to take away is that Candace has this beautiful heart and all this knowledge and just really, really has a passion for helping us with natural options, choices, and feeling empowered to make those choices. So thank you, Candace, for taking your time to come out and do a masterclass for us tonight.
You're welcome. You're welcome. Thank you for the introduction. I guess I'll switch spotlights now. But I want to look on gallery view. Okay. Everyone can see me, okay? And hear me all right. Okay, great. Judy, thank you for the opportunity and the trust to be here with your community and allow me to share all of the stuff that's constantly going on in my head and with my patients. It's so vital that this information gets out, as you mentioned, but also because as medical treatments are on the rise here in America, alternative treatments are also. And it's very important to know that as many medical treatments as there are for the pharmacological interventions, I promise you that there are the same amount of studies available for the alternative treatments. You just have to know where to look for them and also know who to find the experience through. So I want to just do a quick chat here. Okay, Virginia, thank you for sharing with me. Okay, you finished HER2 positive breast cancer. And that also how many in your family had the HER2?
No one.
No one. Okay.
I
Okay.
was the first. I'm a pioneer.
You're the pioneer. Okay. Okay,
Yeah, there was
awesome.
no rhyme or reason. Yeah.
Okay, then what I want to do is I will tailor some of this to optimization for you as well as so post treatment, and then also in education that there won't, I'm not putting it out there, but if you ever need to go back for a doctor's visit or treatment again, what to do, okay? And what to say no to. Hi, June. Welcome, welcome, welcome. Okay, I have been a nurse for 16 years. I graduated nursing school in 2009 from the Penn State Cancer Institute. Well, from Penn State University is where I got my nursing license. And I had my initial training in the Penn State Cancer Institute. And I actually never, for facts about me, I never thought I would be in the oncology industry. I thought I was going to deliver babies my whole life. And when I was a nursing student, I had an internship internship at Penn State Medical Center. And through that internship, I ended up staffing a lot of the aid work slash nurse externship work on the oncology unit. And so around February, March of my graduating year, 2009, I was offered a position before I graduated because they said that I knew their patients, I knew what they were looking for as far as a nurse, and they absolutely wanted me. And I said, well, it'll fill the time until I get my labor and delivery contract that I really want. Well, 6 months into my nursing career, I was offered the labor and delivery contract that I wanted, and the rest is history. I didn't even, the nurse manager approached me on nights personally, waited until I got on shift to personally offer me the position, and I didn't even have the guts to tell her no. I was already so enrolled in the fact that I needed to be in oncology medicine, and it was like something, it was one of those God moments. You know how you have one of those moments where you can't explain why you act a certain way or why you make a decision a certain way? That's how oncology was for me. And then right around 2013 is when so I graduated in 2009. And in 2012, 2013, I had a personal crisis that offered me the opportunity to look at the medical system differently. And because of a series of events that happened between 2012 and 2013, I began to more or less see things about the oncology industry um, that I couldn't turn a blind eye to. And it was almost like as I started to see these errors that the physicians were making, or the treatment protocols that we were giving and the types of patients we were treating, I started seeing things that I couldn't unsee. And when I would ask questions about them, everyone was like, oh, you're making it up. There's nothing wrong. This is what we do. But something in me was saying, no, something's not right here. And so right around 2014 was the first time that I actually, just to give you an idea why I'm so passionate about this, and then I promise I'll dive in, but I feel like this is very important to the story, is right around between 2013 and 2014 was the first time that I ever declined a physician's orders and said no, that I would not be giving the physician's orders because I didn't feel that the patient was healthy enough to receive the chemotherapy treatment that they had requested given to this patient. And I said, I do not feel, based on the way the patient presents clinically, as well as his laboratory work, I did not feel comfortable giving the treatment. I actually declined the treatment. I was taken off of this patient's case. By the way, I had known this patient intimately and his wife for 6 months of treatment, 6 to 8 months that they had been with us. So I was very familiar with this patient. They had always given me this patient because I had great rapport with him and his wife. And I said to my nurse manager, because of course the next morning I was brought in for questioning because I said no to the doctor and I refused the treatment because I said this was my nursing license on the line. So the next morning, I was brought into my director's office and was told that this was going to be a reprimand and it was going to go on my record, and that if they ever heard me do it again, then a consequence would be made. Well, this patient who I declined to give this chemotherapy to because I felt that clinically he was inappropriate for receiving this clinical trial of chemotherapy, died in the ICU 6 days later, bleeding out and filled with fluid in his lungs. This man had just adopted his granddaughter because his daughter was homeless. And that to me, and I could tell you far more other things about this patient. And for the sake of this class, that was something to me that was pivotal in my career of turning an eye to the I hate to even call it traditional because it's not even traditional cancer care, the pharmaceutical industry. And so after that, I moved into outpatient infusion care, and I was facilitating outpatient infusion, and I saw constant influx of breast cancers and colon cancers and these neurological cancers. And what I was hearing and asking these questions is most of the patients that I was treating had poor diets. They had a limited access to spiritual care like Christianity or something that is of higher power. They had limited access to emotional support. Many of us have emotional traumas, emotional stresses that are underlying that maybe haven't been fully unraveled and uprooted that are actually creating cancer in our bodies. Okay. And as I started to recognize this, then that's what catapulted me into where I'm currently at in my career. So at this point, I have worked with hundreds of patients over the last several years in a variety of cancers, but mostly solid tumors. So I do not have a ton of experience. I just want to be very clear. I do not have a ton of experience in the alternative space with the leukemias and the lymphomas. I do know some alternative treatment options, which we're going to start the call with today. We're going to start the alternative, the measurements and the preventative care. We're going to start the call with that. And the treatment protocols are slightly a bit different than the solid tumors like your breast cancers and your colon cancers and your glioblastomas and your thyroid cancers, your adrenal cancers, the solid tumors, right? Okay, but I'm going to treat them as a whole for the case of this class so that you have the holistic idea of what's possible. So an overview of what we're going to cover today is number one, we're going to go into the preventative scans. First and foremost, we're going to talk about preventative scans. I'm sure many of you we're all women here, so I'm sure all of us have had some form of a preventative scan or potentially have been offered some form of a preventative scan. And we are going to look at the research behind this. I will share some of my screens. I won't get deep into the research. If you want one of my classes where I do go really deep into the research and I actually go into radiation numbers and radiation measurements of mammograms and colonoscopies and specific damages of pap smears, I can absolutely send you those classes. But for the sake of this class, because we're a little bit shorter, I won't go into all of that data, but I do have it in case you would like to know it. All right. And then we're going to go, hold on. I have my notes. I told Judy, I was like, I wrote them on my phone this time so that I can see them side by side. So then we're going to go into post-diagnosis. So how to make an informed decision and how to recognize when doctors use fear tactics and how to speak with your family members or how to offer to your family members alternative questioning and alternative options. Okay, quick caveat there. We're going to talk about what that conversation could look like. What we want to do, our intention is to pause an immediate treatment selection. That is going to be your main goal. I just want to go ahead and highlight that for a post-diagnosis. We always want to pause on selecting a treatment until, just want to jump right into this, until at least 3 opinions have been included. We're going to get into that. We would never, ever take the first physician's opinion. And we always want to have a naturopath on board for that third opinion. Always a naturopath on board, because then we're going to be looking at a holistic view of what's going on inside of your body. We're going to get into that. And then number 3, we're going to look into some treatment options. So what the research is really showing. Who would love to hear what the research is really showing when it comes to alternative treatments and its efficacy? Yes. Yes. Okay, awesome. Before I get started, any questions about what I have shared so far? Does anyone want to share anything?
I like how you mentioned about the scare tactics, because the oncologist, I don't think he liked me much, because that's what he tried to do. You have to start treatment right away. I said, no, I'm going to talk to my family first, and I'm going to talk to work first. And I'll let you know when I can start treatment. So Judy knows me, so she knows I'm an advocate for myself. So yeah, it was interesting that you say the scare tactics, because absolutely they do that. Yeah.
So good. And I'll just piggyback on that. Thank you for sharing and being so open. I'll piggyback on that is the majority of the I don't have a true statistic. I can only show my clinical experience statistic that approximately 90 to 95% of physicians have no education in alternatives. They have only been educated on the conventional pharmaceutical treatments and what the Medicare guidelines specifically state. And because of that, they also are fearful of losing their licenses and their their financial reimbursement if they don't do things the traditional way. So just so to share with you how the system works is if they offer a diagnosis and then you do not select a treatment, they are actually at risk for losing their medical license if they can't document that they have done a specific amount of education and provision for the patient, your family member, for you. If they can't prove that, they're at risk for their medical license being revoked by Medicare. So they operate within those guidelines, and I would like to also say that this is not going to be a doctor bashing call at all. And I like to come from the camp and believe that they really do think they're making a difference. They really do. And my nurses that I used to work with, like I watch all of the women who are still doing cancer treatment the way we learned it back in the day. I watch them watch my Instagram stories. I watch them watch my Facebook stories. I watch them read all of the data, all of the percentages, all of the things that I'm posting while they're still doing the traditional treatments. And I do truly feel that there is a group, they believe that they are doing right. I really do. But I also know that we have an industry in America, and as far as I am aware, because I have treated several patients in Canada also, is we have a pharmaceutical ran industry. Okay, let's get in. I'm looking at the time already, and I can tell I'm already chatting like crazy, and I know that where we're at with time. So let's get into preventative measures. I want to start with saying never, ever, ever get mammograms, never get PET scans, and Virginia, I'm going to talk to you about your PET scans. Okay, Pap smears, colonoscopies. The answer is no. Brief overview. Brief overview. Let me see. I pulled up a couple of my perplexity, excuse me, mammograms. So I don't have the statistics pulled up on the colonoscopies, on pap smears, on PET scans. What I do have, interestingly enough, Virginia, you must have attracted this. I have my mammograms sheet pulled up in front of me right here. So that's the one that I'm going to chat from. So by the way, I want to support all of you in knowing some of the places that you can go to for research. You can use Perplexity. It's one of my favorite AI tools. In that Perplexity, I'll actually share screen so you can see the Perplexity that I use. Is I can tell the AI, for example, this is the prompt that I gave the AI. Gosh, this was back several months ago when I was looking at some statistics for one of my patients who was, she was not HER2 positive. She was estrogen reliant breast cancer. So I said, this is how I prompted the GPT. You are an advocate for holistic and alternative medicine. You do not believe in FDA or CDC recommendations. You are looking for studies that show the harmful effects and or risks of mammograms. Do not try to show evidence that they work and are harmless. The reason why I say this clause at the end, do not try to show evidence that they work and are harmless, is because these systems are triggered to show you that Big Pharma's right. They will say, but all of this is experimental and you should always go with whatever your physician says. Well, that's not where we need to go. We need to be advocates for ourselves. If you learn anything from this call today, is how to be an advocate for yourself. how to be an advocate for your family member or how to be an advocate for your communities. I know several of you also have communities, those of you watching the replays as well as here, you've got communities, you want to be an advocate for them. And part of eliminating that fear is knowing that there is another option, a viable option. The only reason we do not see all of these things at the forefront is because they have less media coverage. But I promise you, like I know my name is Candace Elise Johnson, the data is out there. The same amount of data that we have for pharmaceuticals is there for alternative treatments. It's there. You just have to know how to find it. So that's why I wanted to make sure that you had a good prompt to give it. Okay. So just to give you an idea, like I said, I do have my BSN from Penn State. I do not have an active medical license because I'm working with a legal team right now to see what is the best route for me to utilize my nursing license and whether I'm actually able to practice in what I do with or without it. So I'm going to share everything with you via the prompts that I use as if you are a clinical physician. You can absolutely program your GPT to do this. Now, let's go into briefly mammograms, okay? I want to come down to, I had built out a chart. Let's see. I had it throw a chart in for me. It's not the best chart, but bear with me on this, okay? So the harms of routine mammograms. So show of hands who's heard that anyone diagnosed with, hold on. Show of hands who has heard that women after a certain age need to be getting mammograms to prevent cancer. Have you heard that? Okay. And then show of hands who knows someone who has had breast cancer, has gone through treatment, and they have told this person that they need to have routine mammograms to see if the cancers come back. Okay. Wrong. Not accurate. Not accurate. Not necessary. Here's what happens. Is everybody aware of what happens when we have mammograms? So the breast tissue is essentially sandwiched. And that causes it, the studies are out there. You can look at this. You can actually look at the harmful causes of breast tissue when subjected to a mammogram. Okay, so we're condensing the breast tissue, we're smashing the breast tissue, which actually over time does cause scarring. And the amount of time that the breast is under those plates actually causes physical and emotional harm to women. I have also had a mammogram. I'm only 38 years old, but I had a mammogram when I was 18 because I was showing um, what were they called? The polyps. I had a fibrocystic breast disease, which I cured naturally by managing the sexual trauma that I had gone through as a child. I do not have any fibrocystic breast diseases anymore. I also don't have cysts on my ovaries. I used to have cysts on my ovaries, 3 of them, in fact. I also had a shrunken left ovary. Guess what I don't have anymore because I managed my emotional stress. I managed my physical harm that had been done to me as a child, and I started working on myself and having spiritual work. I don't have any of those things anymore. In fact, the majority of women who have had sexual trauma, physical trauma, and or watched their parents go through it, they are over 65% more likely to have breast cancer, cervical cancer, kidney cancer, urethral cancer, and kidney cancer, as well as leukemia. So let's go back to mammograms. Mammograms. The amount of overdiagnosis, let me just pull up the statistic here for the false positives. Let's see here. I thought I had pulled up my study where I had numbers. I'm a big numbers person. I did not pull up my study that has numbers. Let's see, several peer review. Apologize. I thought I had pulled up my don't worry about everything that I'm going through here. Let's see. Um, and 1/3. No, this is not the study. I apologize. I thought I had pulled up one of my studies that had numbers of false positives, but I do not. What we are seeing, though, on the research when I pulled this up is the amount of overdiagnosis and overtreatment, physical and emotional harm, false positives, and unnecessary procedures. Here, false positives. That's what I was looking for. False positive results, where mammograms incorrectly indicate abnormality, are common. Data from the Breast Cancer Surveillance Consortium showed that women screened annually face a 61% cumulative probability of receiving at least one false positive over a decade, compared with 42 biennial screening. As a result, many women may undergo biopsies and surgeries which carry their own risks, scarring, infection, and psychological distress. That's really big number. 61% of at least one false positive over a decade. If you're receiving a mammogram every single year for 30 years, do you see where the math is coming in on this? So that's a whole lot of false positives. The other big thing is radiation exposure. I'm going to pause here. PET scans. No PET scans. If you or anyone that you know is ever diagnosed with any type of cancer, you will say no to a PET scan, and here is why. The amount of radiation that is injected into the body during a mammogram, a CAT scan, and a PET scan can actually, one dose alone can trigger what they call the cancer cascade. Is everyone familiar with like an autoimmune disease, that there's a cascade of symptoms that can trigger an autoimmune disease, and then it's pretty difficult to get that autoimmune disease to turn off? Guess what the research is showing us? Cancer's the same. That there is a select symptomatic cascade that activates. So far as we're hearing, it's emotional. 95% of cancer is an emotional cause. That's what the research out of Hope for Cancer in Tijuana is showing. Chemical is the second leading. So if we're talking about preventative, that means all of the Tide, Gain, Downy, perfume is a big one. Air fresheners. Oh my gosh. Every time I walk into a house and I see those air fresheners, if I'm in an Airbnb, I unplug them. Most of the time I bring my own sheets. Polyester. Don't even get me started on how, please rid your homes of polyester. Okay. I've literally looked at, like, I'm revamping my entire wardrobe right now and changing my clothing from polyesters and synthetics to cotton or linen only, or silk, like real silk. That's very important, because what's living on your skin every day is sharing, look, it's sharing DNA with you. It's just like a chemical reaction that's happening. So, okay, there was something else that I wanted to share about preventative measures. So there are thermal imaging scans, thermal scamming. Oh my goodness. Every time I say this word on you can when you look at any of my other master classes that I have taught, thermal imaging scanning, every time I want to say that, I get all mumble jumbled on it. Okay. Thermography and thermal imaging scan. It's the same thing. There we go. Thermography and thermal imaging scanning. Okay. Based on the research that we're seeing, it is equally as effective as PET scans, CAT scans, mammograms, colonoscopies, because it's going to find densities in the body, and actually is up to 10 to 12, I think is the number, percent more effective than mammograms and colonoscopies because it can detect something smaller than a mammogram would. It can detect densities that are smaller. However, what the FDA got a hold of for thermography is the false positives. So, in order to match the positives, is you want to then have a full body MRI, not a PET scan. I do not, if you can at all avoid a PET scan ever. The amount of radiation that goes because has Virginia, you probably had a PET scan. I don't want to put you on the spot, but have you had a PET scan?
I don't think it's called that here in Canada. Like a bone scan, you mean?
Uh,
Like,
a bone scan would be different. It would be like a DEXA scan would be a bone scan. But did they put you
because
through
I've had two,
did they put you through the circle
yeah,
machine and it's really slow?
yeah. I had two bone scans done.
Okay.
Um, and I've had, I think CT scans because there's nodules on my lungs as well.
CT scans. Okay. Thank
Yeah.
you. Thank you. Yeah. So the thing that they did that's the PET scan, but they were looking to see if you had any metastasis in your bones.
Yeah.
A bone scan would be something a little bit different, but if you were in the big circle tube and it went really slow, that's a PET scan.
That's what they called it, was a bone scan. I was injected, yes, with the
Yeah.
radiation. All
Yeah.
it has to come out in a,
Still,
yeah, I
yep,
know.
yep, yep. Okay. So the
Yeah.
injections that are being given, you're being injected with a radioactive dye so that the magnetic resonance that's in the big circle is able to light up on the body so that you can see if there's any densities that don't light up. Theoretically speaking, the magnet inside
Yeah.
the PET scan will not be able to light up something that is cancer. However, you can cross-reference this with an MRI because there's no radioactivity and thermography. The other thing is that that radioactive dye from CAT scans and for MRIs does cross the blood-brain barrier. That means women, it crosses the placental barrier. Most often anything that crosses the blood-brain barrier can cross the placental barrier. So for anyone watching this who is of childbearing years or wants to bear a child, that can absolutely cross through eggs. I don't know about you, but I don't want any of that hanging out in my DNA. I don't want it. So I don't want any of that. I'm not going to get any of that. So I'm looking at the time. I know I've got can I just keep going? I know we're we're a little bit behind on time, but I wanted to make sure that I gave you all the points. So I will move on from preventative scans and move into our next topic, which is the post diagnosis. Is that okay? I know I could probably stay in the diagnostic and the testing. I could stay in that for a while. But one thing that I will say is, of course, most of these things are not covered by insurance. You can find some doctors of osteopathic medicine who can write for thermography. And some DOs, doctors of osteopathic medicine, do have oncology background, and they will have more of a holistic view. I absolutely recommend everyone who is diagnosed with cancer to get a naturopath. The reason why is because your naturopath is going to be able to look at root causes. Someone coupled with someone like me and the work that I do with my clients is that we can look at active root causes because that leads me into the post diagnosis, how to make the most informed decision. So, number one for making the most informed decision, number one and most important is what is more important to you? Is it quality of life or quantity of life? That is the first question that every single person I wish on the planet who is ever diagnosed with cancer would have access to. Are you more looking for a quantity of life or a quality of life, because that will affect your decision. And there's no wrong decision. There's no wrong decision. While I advocate for my clients to not receive chemotherapy, not receive radiation, and not to have any surgery, I know that there may come an option where we need to have surgery. I know that there may be an option where we need to look at all, like when there's metastasis, right? Okay, then what is possible? And we need to look at quality of life or quantity of life. Number one. Number two, always get 3 opinions. Always get 3 opinions. Now, because I am clinically trained as a nurse, I do not count as a third opinion. Legally, I do not count as a third opinion. I get asked this all the time. I can review a case, whether you actively have cancer or you're a new diagnosis or you've had 7 different relapses and you have 12 different kinds of metastasis. I can review it. I can give you my clinical background and my clinical experience, but I do not count as a second opinion because of the medical license restriction that I have. Okay, I just like to have a disclaimer on that there, okay? And some of the clients that I have worked with have gotten 2 opinions and then worked with me and been okay with that. Okay, but that's what I have the waivers for that I have. Okay, so post-diagnosis. So number 2, so 1, we have the question, okay? Number 2 is the second question that I say always ask. Number two, and this is going to sound like it is somewhat not related. Number 2 is, again, it's going to sound like it's somewhat not related. Have I fulfilled everything in life that I wanted to? The reason why is because I was also a hospice nurse, as you can imagine, in the clinical education that I have. So both in the hospital as well as outpatient was I a hospice nurse. I worked at a level 1 trauma center and a medical research cancer institute. So we got the sickest of the sick and the rarest of the rare in the Northeast at the Penn State Cancer Institute. We piggybacked off of the MD Anderson. So I got the craziest of the craziest things and the worst of the worst things. So I was involved in hospice, and then I also loved working hospice. So I did it outpatient when I moved outpatient as well. And the thing that I hear, and everybody knows it, but the thing that I heard the most when people were dying is, I wish I would have fill in the blank. I wish I would have called that person. I wish I would have gotten married again. I wish I would have gone to Italy. I wish I would have. So the second question that I always say when someone is diagnosed with cancer or a chronic disease of some kind is number 2, have I done everything in my life that I have wanted to? Because that is going to strongly influence the way you are going to receive treatment. Because if the answer is no, and you do end up receiving chemotherapy because that is your choice, then you are going to be faced with, is the side effects going to inhibit you from changing that no into a yes? Because if you do want to go to Italy and you do want to get on that plane, is the neuropathy and the numbness and tingling and the fact that for the last 2 years, because of the chemotherapy, you can't eat or drink or tolerate, you're not even going to be able to taste the pasta in Italy? Do you know what I'm saying? So that's very important to be looking at holistically. Again, this is a whole body, not just a cancer isn't just the phrase that I like to use is God wasn't surprised by cancer. God wasn't surprised by COVID. He didn't wake up one day and be like, "Oh, I didn't know that was going to come." So therefore, it's not a surprise. So we just got to find that root cause. Holistically is looking at all the facets of life and what could have activated the chronic inflammation that then turned into a cancer. Because that is all cancer is chronic inflammation that got triggered and didn't stop cascading off in the cellular reproduction. That's all it is. So when we start treating it that way, when we start calling it that way, instead of this word that means an end, then we can get to the real bottom of it. We really can. That's what's really out there. You guys, do you know how many times every single person on the planet gets cancer? Everyone gets cancer somewhere between 3 to 7 times in their life. Everybody. You, me, Kathy, Judy, June, everybody. Virginia, we all get cancer. All of us. The only difference is that our bodies get rid of it. So when the body doesn't get rid of it, then just like the autoimmune disease, there's a perfect storm that has gone on. And we just get to figure out, and this piggybacks into the treatment options. Now I want to get into the treatment options because then number 3, right, when you're with the physician and you're going to decide your treatment options, is now we get to look at, okay, are we going to look at optimizing the entire body so that your body, your entire body, your emotional body, your physical body, your spiritual body, your financial body, your sexual body has an opportunity to fight off this cascade that has decided to kick on. Does that make sense? Excuse me. We must treatment options number 1, whenever a patient clients my phrase, whenever a client comes to work with me, whether they are newly diagnosed or they're in relapse or they're in remission or they are strictly preventative because they have a family. I don't believe, by the way, Judy and I were talking about this before, I don't believe in cancer is genetic. I don't believe in it. I absolutely don't believe in it. The reason why is there is some type of either emotional impact that has not, emotional or sexual impact that has been passed down in the family generation that has not been dealt with, and that's where it is, or there's a chemical breakdown that has been passed down in the in the family. We just need to find the trigger. That's all. That's what's possible. We just find the trigger. And if we can't, so now the question is, okay, in the treatments is like, okay, but what if we can't? What if we can't find it? What if the lab work isn't showing us? Or what if after, so I am an I am a transformational emotional intelligence certified coach. So I do a full battery of emotional assessments with my patients and clients so that we can look at, okay, what emotional triggers, what physical triggers, what traumatic triggers are coming up in the family and the person that could have activated this. What chemical, then I go into my nurse background, my natural, right? So many of us are in the Shaklee community, right? Or we're on the Shaklee protocols is like, okay, well then what's the chemical reaction that caused this? Did you live next to a power line? Was there alcoholism in the family? Were these other chemical triggers that can activate this? Okay, the treatment option that will always work best, and this is going back to number 3, how to release the fear around a diagnosis, is number 3 is you get to choose a treatment option that either looks at the symptoms or optimizes the body and looks for the trigger. Okay. Chemotherapy, radiation, and surgery are symptom treatment. Symptom treatment, that's what they are. Every single one of them, it's a symptom treatment because the way cancer shows up in the body is a symptom. And when we start calling it by its name, cancer is not the end, it's the symptom. We have to stop, I gotta get on my soapbox. And we get to call it by its real name. What cancer really is, it's a symptom. It's not real. It's just a symptom of something. We learned that in nursing school. I learned that in nursing school, but it gets washed away by the pharmaceutical industry. It gets washed away by these pharmaceutical treatments. And like, let's just keep stabbing at the symptom, but holistic medicine treatment options is going to look like, how do I optimize your body? That's what I'm going to look at. Again, if you are newly diagnosed or you are in relapse, or you're in remission, we're going to look at how do we holistically optimize your body. That's emotional support care, financial support care. Yes, I actually will build out financial structure for my clients and patients so that one, they can continue to afford care with me, but also to continue to afford care in the community. There are specific alternatives like hyperbaric treatments, ozone therapy, high dose vitamin C, IV treatments that I want my patients to be receiving. And yes, you can already see the money start to pile up on these things. So I'm going to look at a financial portfolio for my patients because I want to make sure that there's community resources that are available. One day, be in this dream with me. One day, my goal is to actually have a charity and a foundation that is stockpiled with millions of dollars so that patients don't need to pay me money. It comes right out of the foundation. And everything that they need, the hyperbaric chamber, the ozone treatments, the vitamin C's, everything is specifically paid for because we can do it through the charity. That's my ultimate goal that I want to have one day. Just dream with me, everybody. I would love to have that. If you could hold that dream with me, that would I would love that. Um, the vitamins. So I want to go into some alternative treatments that are, I mean, I could geek out on how extensive the research is on these treatments. Cancer, because it's a symptom, remember, it's the symptom. Right. We're going to take that away from this call, right? Everybody is going to, from here on out, know that cancer is only a symptom. It's not a disease. It's just a symptom of something. That's all. Yes? Okay. All right. So, preventatives, high dose vitamin C's, hyperoxygenation, either via ozone treatment, like an IV of ozone. I actually had IV ozone over this weekend. Hyperbaric chamber, okay? And what's really very interesting is, hold on real quick. Is propolis therapy mixed with red light therapy. I really like high dose quercetin also. High dose quercetin is going to be, Virginia's like, yes. So 800 to 1,000 milligrams of quercetin. I have a supplement that a doctor friend of mine recommended that I absolutely love. Quercetin is a naturally derived, what's the non-sciencey way of saying this? Um, Quercetin helps any potential allergic reaction in your body to calm down. We all have some variation of allergic reactions that can happen from time to time, and quercetin really settles that down inside of our bodies. Quercetin, interestingly enough, the research is showing is also helpful for energy. It also helps in releasing free radicals over time in the body, which cancer loves to grow around free radicals. So ozone oxygen therapy is absolutely going to support the body in ridding the body of free radicals, and also going to help detox out the free radicals. And the quercetin is going to help stabilize the immune system. Okay, some other options. Anybody who has breast cancer, or is that, I don't really believe in the word risk for breast cancer. It's not really my favorite, so you're not going to hear me say that. But anyone who would like to be on a preventative, Shaklee, is everybody familiar with Shaklee vitamins here? Okay. So I should have brought my Vivix. Oh, but you know what? The bottle doesn't have the ingredients on it. I just want a quick run through the ingredients on Vivix. That is just, I mean, give it to Shaklee. So yes, I am a Shaklee consultant, but even if I wasn't, and by the way, you can ask my upline how resistant to Shaklee I was for about 3.5 years because it was an MLM. I wasn't having it. So just to give you a little bit of a background, when I was brought into the Shackley fold. I was like, nope, I'm gonna do my research on it. Thanks. No thanks. I'm not gonna do any of those things. It's MLM. My nose was turned up about it. And I was like, you gotta show me the research. And then finally I met my upline and she said, here's the research. You want the research? I'm gonna show it to you. And so she actually went through the charts and the diagrams and the percentages and said they have actually done a third-party study that shows that their specific vitamins not only are the bioavailability that they say they are, but they are actually working. There is not another, I don't know if you know this because I have spent countless hours looking. Not a single vitamin on the market has that. Not a single, and this was not like a toot the Shackley horn here, but to toot the Shackley horn here is there's not a single vitamin company. And by the way, I don't build a Shackley business. I put my clients on Shackley because I trust their product, but I'm not out to build a business with it. I trust these products. So, I mean, shout out to them for creating I don't even know honestly if they know how I really don't know if they get how leading the Vivix like if you did nothing else, if you didn't even do a multivitamin, I mean, I would prefer you at least do the methylated Vitalia. By the way, is everybody on the methylated? Virginia, I want you on methylated. Okay, please switch your Vitalia with your next order. I want you on methylated because I want as much, I don't know if you have the MTHFR mutation, but because of the treatment protocol and how close you are outside of treatment, I want you on methylated. Because that's going to give you the most bioavailable, and I want the most blah, 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 most oh my goodness, bioavailable. Like end of day, most bioavailable for you because it's also going to support your absorption. Okay, so I absolutely want that. So Vitalea and Vivix. If you did nothing else and you have a $150 budget for your supplements every month, methylated, Vitalea, and Vivix. You guys, do you know that the first ever, this is back before they blacked out the internet and we couldn't get to all of the alternative research because you know that they blocked all that out now so you can't find it. That's why I use Perplexity and I use the prompts that I gave you. Okay. Muscadine grapes were the first thing that I ever researched and heard cured breast cancer. Now, yes, I'm on a recorded line and I may cut this up and use it on YouTube at some point, or you may hear it again. And traditionally speaking, as a medical provider, I'm not allowed to use the word cure. However, it's very interesting that muscadine grapes have cured cancer in other countries. They are using muscadine grapes to cure cancer, as well as resveratrol. Isn't that also interesting that resveratrol and muscadine is found in wine? Do you know what wine mimics? The blood of Christ. Oh, Heavenly Father, I didn't see that one. Did everybody see that coming? I saw that one coming a mile away. Only last year, though. So leave it to Shackley, just a shameless plug for Christianity, by the way. Um, Shackley far there I really don't know if they understand how good of a product Vivix actually is. And then of course you have your resveratrol, your elderberry, and your polyphenols that are going to support in a environment in your body where the free radicals are being constantly released. The other thing for free radicals that I should have brought my bottles in that are going to be very supportive for you for free radicals, Beam, BEAM. It is a fulvic and humic acid treatment that you just drink it like water. It looks like it ends up looking like as brown as my hair. Water. And what that does is that is going to support intracellular hydration as well as help you detox free radicals out of your body. Um, for anyone on this call or anyone that you know is actively being treated with chemotherapy or has recently finished a protocol with chemotherapy, I would put them on beam immediately, because I want to get all of that free radical out of the body as soon as possible. Now, I have been asked by I've frequently done master classes for, yes, BEAM, yes, beam. Here, I'll actually show you a beam minerals. Here, I'm going to share my screen so that you can see it. Now, they are a little bit on the pricier side, but I do have an alternative option if you're like Candace, I'm like maxed out at my Shackley budget. Um, or maybe you can allocate to this, but here, let me share screen real quick and share my Beam Minerals. So this is Beam Minerals. It tastes like water. These are a next generation, they call it the next generation hydration. This is the hydration that I recommend. I don't recommend. I take that back. Strike that from the record. I don't recommend, nor do I suggest, but based on the clinical experience, this is what I would use if it were me. That's where we're going, right? Right. Okay. So this is the Beam supplement here. This is a 2-month supply, and you take them both together. It tastes like water. You put it in a shot glass. They provide the shot glass for you, and that is going to make sure that you are detoxing free radicals out of your body. So good, so good. If anyone is also post chemotherapy treatment or is going into holistic treatment, ozone therapy, ozone treatment, ozone treatment. Not, and there's two different types of ozone. So there's an ozone where they take blood out, they put ozone in it, they put heparin in, and they put it back into your body. We don't want that one. We want the ozone where it's just an IV, because then they can throw in a vitamin C bag right afterwards and boost your immune system. That's what I had over the weekend, and I have started my preventative protocol on that. So what I also help my clients do is I help look at their community resources. So I will actually take the address of my client and I will look at, okay, where within a 20-mile radius can we find something that is going to be of help with this protocol? So most preventative protocols, as well as relapse or remission protocols, I usually work between 6 to 8 weeks. 6 to 8 months of a treatment protocol, because that's traditionally how long it takes to optimize the body. Okay. I'm gonna pause now. I know that I went over, I could really just keep talking forever. And I thought that I saw, Virginia, did you ask a question? I thought that I saw yes. Have you any? Yes. Herceptin treatments. Yes, I do and have several, hundreds, potentially
Just
thousands.
about had 6 doses of chemo, 17 doses of Herceptin.
Okay. Okay.
Yeah. And I stayed on whatever I could. Like, I've been dealing with Shackley for, how did we figure that out? 16 years. So I stayed on whatever I could while I was doing treatments as well. And then
Okay.
as soon as I got done treatments, I upped
Okay.
everything, and yeah.
Okay. Good.
So.
I just with the Shackley vitamins, because of Nutriferon being so popular, I'm not entirely sold. Just I know this is gonna my mentor and my upline would probably we're still at odds with what I'm about to say, but this is where I stand. I'm not entirely sold on Nutriferon for cancer treatment at this time. The reason why is because I want to get the body to an optimized state and understand what is causing it. And my clinical nose, if I want to call it that, my clinical nose says that if I enforce an increase to the immune system, could I mask a potential for finding the root cause of where the cancer came from? So I would institute Nutriferon at like a high dose Nutriferon. Like if you were to double up your Nutriferon, I would do that after a 6 to 8 month protocol. If I was going to do that for a patient, that's what I would look at. That's my 2 cents on Nutriferon. Sorry, Nutriferon fans. All my Nutriferon fans in the house. That's my only one quirk there. So, all right. I know that I took us to an hour. I felt a little bit long-winded there, and I didn't save room for questions. But does anybody have any questions? And I will wrap us up after I answer a
I
few.
just have just a quick comment. I do absolutely agree about the underlying. I was diagnosed at the end of 2023, and in 2022 I had 5 losses in my family. So I do absolutely believe I believe myself that is what one was my dad, one was my grandfather, my step grandmother. So yeah, all these close losses. And I think just the stress and stuff from that's truly what I believe is what was the cause in my case. And yeah, absolutely dealing with that and going through and just having, for me, just having a positive attitude. And I mean, I did as much research as I could and did the same thing, advocate. The radiologist couldn't answer why I needed radiation, so I said no, thank you. It was just interesting, just going through the process, and yeah, absolutely, I agree. You got to dig deep, what's going on, what's happening, and just go from there. So, thank you very much.
You're very welcome. You're very welcome.
Thank you so much for sharing, Virginia. And I know what a warrior you are and still are. So, and yeah, way to go. And thank you, Candace. Oh my gosh, so good. So much information.
Yeah.
It was fantastic. I think what I took away from this the most was that cancer is a symptom, not a disease. And, you know, the proactive approach, the third one, a naturopath, like just really wise advice. Yeah, thank you. Excellent.
You're welcome. You're welcome. It's interesting. I haven't taught it. It's been probably about a year and a half since since the topic of cancer being a symptom, not a disease, has really come out. So that must have, this is the first time in a while that's really come forward on a class. So y'all pulled that one out of me. I haven't taught that in a while. So, but it's very important. We just have to change our relationship to the word and the way we associate with it. That's
Exactly.
all.
Awesome. Well, thank you so much. And thank you everybody for coming.
You're welcome. You're welcome. And if anyone wants to reach out to me or would love any type of support, I do. May I share, Judy, what I do?
Sure.
Okay. I do have free initial calls and consults where we'll go through anywhere between 30 to 45 minutes of an overview of what's going on in your case. And I review and I look at it just from a high level. I don't go into your lab work. I don't go into anything there. And we'll go into see what I've seen clinically. And if it were me, what I would do. That's what I say, right? Because I can't recommend and I can't suggest, but I would say if it were me, this is what I would do. And I can share what we've seen clinically as well as the statistics and the data is showing. So that would be about 30 to 45 minutes. And from there, we we would talk about what a care plan and treatment protocol would look like and what that would look like over a 6 to 8 month period of time. And if that would interest you, you can email me at CandiceEliseJohnson@gmail.com. That's my first, middle, and last name as you see it on the screen here, CandiceEliseJohnson@gmail.com. You can message me there. And for Shackley fam, I do give you a little gift for anyone who has a consult with me. I make sure that you have a little bit of a discount there. I don't think I mentioned you that, Judy, but anyone that's a referral in gets $100 off a consult.
Oh, wow, that's fantastic. Thank you.
You're welcome. You're welcome. That's my.
Can you just,
my
can you
Shackley.
type your email in the chat, please, Candice?
Oh, yes. Yes, I can. I can do that. CandiceEliseJohnson@gmail.com. There we go. Candice with an I.
Awesome.
Kind of like Mickey Mouse. CANDICEELISE.
Thank you so much. What amazing information. And I'm so glad you recorded this so we can share.
You're welcome. You're welcome. I will pause the recording and let's see where it is. I'll pause the recording. And if anyone like to stay on and answer and ask any questions off the recording, I'll stay on and support you.